Clinical psychologists, trained in empirically derived, reliable and valid assessment, evidence-based treatments, and on how to conduct research and evaluation, must be among those best positioned to support individuals experiencing mental health difficulties with evidence-based practice. However, this becomes more challenging when working within populations where robust literature to draw upon may not be available. If evidence-based practice is an ethical imperative, how do we maintain this value? Indigenous people comprise 4.9% of the total population of Canada and are the fastest growing segment, growing at a rate 4 times that of the general Canadian population. When compared to the general Canadian population, Indigenous people experience disparity in proximal, intermediate, and distal determinants of health. As a consequence, the Indigenous population has higher rates of mental health difficulties. At the same time, Indigenous communities often have limited access to mental health resources and specialist care. There is recognition among many Indigenous people that culture-based interventions are effective at improving psychological function, and among an increasing number of clinicians, there's recognition that integrating culture-based and evidence-based practice approaches for mental health difficulties is important, but few concrete examples of how to implement this integration are available in the published literature. While there is a small literature on culturally adapted psychological interventions for Indigenous people are diverse with rich cultural traditions, languages, histories, and methods of healing. For example, within many Indigenous communities, wellness is viewed as holistic, that is, a balance between physical, emotional, mental, and spiritual domains. This is a view that's different from psychological training and evidence-based practice, which tends to focus on deficit as the target of intervention. Applying evidence-based practice with specific populations that are underrepresented in literature is an ongoing challenge. On one hand, there can be a tendency for clinicians to ignore the issue altogether, and on the other hand, to overcorrect and assume that the evidence base is not applicable. It's likely not the case that evidence-based practice is not applicable to Indigenous people. Aside from the empirical literature on culturally adapted interventions, cross-culturally validated constructs in personality, neurodevelopmental constructs such as executive function and cognitive ability, and emotional and behavioral measurement, for example in self-efficacy or adaptive behavior, are important considerations in assessment and treatment. Are working memory, inhibitory control, attention, emotion regulation, or problem-solving abilities strictly non-Indigenous individual difference variables? Or is it possible they're important constructs that might influence the course of an Indigenous person's healing journey and require consideration that's grounded in both psychological knowledge and traditional Indigenous culture-based approaches? Is understanding how one's thoughts might be related to one's feelings and behavior inherently non-Indigenous? What is important is to consider how constructs are manifest, that is, culture, and measured among Indigenous peoples, as well as knowledge of aspects that might contribute to one's outcomes, that is, context. Balance is required. Evidence-based practice requires clinical competence to ensure culturally and contextually appropriate care. This requires humility, respect, collaborative goal setting, ensuring that there's a shared understanding of desired outcomes, and then monitoring progress towards those outcomes. Collaboration and partnership with Indigenous people and those who have the culture-based knowledge to help is important in providing evidence-based treatments that meet the needs of Indigenous people.